Last but not least, knees flat. I'm sorry, knees up, feet flat. Okay, trunk flexion. Now, I've learned, I had the lovely experience of learning ways to actually try to get a hold of rectus abdominis and inhibit it, which turned into a lot of, Gah! I'm not gonna have us do that, okay?
Yeah.
Here is a place to assess how their core is functioning during trunk flexion, and then helping potentially encourage them to identify what better core function is so that they can move forward knowing what the right sensations are when they use their core correctly, okay? So we find their belly button. You can even have them help you. Okay, so a person finds their belly button. We need to be below the belly buttons. Okay, it's the lower obliques. Okay, and on either side, relax. As a reason to have you palpate further, if we can find ilium, iliac crest, anterior superior iliac spine, posterior, so iliac crest, posterior superior iliac spine. We were finding this so that we could get on those lumbar rectus spinae for the hip extension one, all right? Here, if we find this, belly button to this, we wanna be here. The lower obliques, we wanna be here. Below the belly button, but not too central, over here to the sides, okay? Usually I use two hands, not one hand. Now, we want to find those. That's what this looks like. If you ever see practitioners doing something that looks like this, here's a pelvis. They're coming over and they're going, what's this? What's going on? And they're putting their thumbs on the anterior superior iliac spines and then looking at what the pelvis is up to. And there can be distortions there, okay? Now, we're not going to worry too much about that, but it can be really important for you to be able to just palpate those. They're easier to find in this position because you just track the outside of the leg down and your thumb will find it. You might have to have your client guide you a little bit. Okay, cool. So try flipping your arms. Yeah, and standing like almost where you're like you're touching the leg like this, just so you could be looking at the belly button. Okay, this is an important assessment for future. Be able to just find those anterior superior iliac spines. So, you found them? Good. Done. You know where those are? For this, we're going to be palpating here on either side, and then whichever hand, you have a thumb that's nearby, comes over right in the middle. So, look pretty good. Just your fingertips need to be palpating the obliques and a thumb right there in the middle. Yep. Now, we have the person to start to do a crunch. So start to crunch forward. Okay, good, back down. Well, again. Little active there. Relax. These are big muscles, they're important, but people are weird about working on the belly. And I get it, but you gotta find ways to do it that's maybe a bit sneaky. Make it about the low back. Make it about breathing. And it's less awkward, okay? Now, to coach better core functions, usually what we gotta tell a person to do is not suck their belly in like this, but just draw their belly button in. It's kind of a hard thing to find, but if you watch me, the action I'm looking for, and you have them put their belly, they put their fingers right on their belly button, and they're trying to just do this. They contract their abdominal muscles so they kind of get that to sink in, but it's not this. Not sucking in, trying to be a Superman, right? It's just feeling like you're activating your abdominal muscles enough to make that belly button drop in a bit. Okay, and you should be able to see it. So you coach them, they're doing it. So Sarah, finger on belly button, and we'll draw in, okay? Now do the crunch. Aha, we'll start one more on belly button, just so we're illustrating it. So then you draw in, good. Then little activation, trunk. Good, back down. Now, all I'm doing there, in this case, would be helping a person know what the correct action feels like. So that when they move forward, this is what I'm telling them. If you go do crunches or other core-based things, it can be even standing, like draw that in and then grab the thing that you're gonna lift and carry around, right? So this is a way to encourage people to more efficiently understand how to use their core. And it's if you can just do this more isometric action, then load or do the movement, that's gonna be what protects your spine, because everything's coming in, it's like a big weight belt, anchoring and holding everything nice and secure just above the pelvis, then you do the movement. Okay, that's that. Swap, swap.